One of the most important elements to this discussion is hearing from those most impacted by access to insulin, people living with diabetes and their families, health professionals, and others.
The two biggest challenges on access to insulin in Peru are availability and price. While in Peru, insulin is tax-free, it's still too pricey for the average citizen.
In my country, most of the people are poor and most of them cannot even afford health insurance. This challenges them because they find themselves not being able to afford the payment for the insulin on a regular basis.
If it wasn't for my father's insurance, I wouldn't have insulin at all. And it's very difficult for me or any independent workers as diabetics to access any insurance because diabetes is considered as a pre-existing condition.
وضعنا يعني كتير تعبان شوي بهالغلا وهكذا تعبان يعني هلا أنا الإبرة الأنسولين عم يعني أحتار وين بدي أحطها عند جيراننا بالراد ما عندي أنا خسالي ما عندي أنا ما في عكرت هالتغذية شو بدي أعمل هلا 40,000 شو عم يعملوا ما عم يعملوا شيء.
The only place in Tanzania where you can find all kind of insulins is Dar es Salaam. But the price to some of those insulins are too expensive for a person to afford, and also to afford those insulins and also to afford other living expenses.
Through our healthcare system, which is great.
People in remote areas whereby the only way to find insulin is to go to the district hospitals, and these patients are being challenged by both the journey it takes to reach the hospitals and of course the time that they spend to the hospitals waiting to be given insulin. This might take almost 2 days to some of the patients waiting to be given insulin.
Of which mushonga wacho ndinowana uri mushoma zvekuti dzimwe nguva andizvibayi dosi chaiyo yakakwana ndinotojamba zvekuti kana kuti ndikazvibaya nhasi makuseni ndongozvibaya ka1 because ndinofanira kuti ndozvibaya 30 makuseni 30 manheru but ndienda kuzvibaya 30 makuseni chete ndotojamba ndozozviona futi mangwana because mushonga unenge uri mushoma.
Not everyone can access to the best insulin for their treatment. Not only because the big difference in costs, but also they don't reach the remote population.
Sometimes the insulin that I need or the insulin that I am familiar with is not available. So it has to be substituted by another type of insulin or another kind of insulin that works the same way but not 100% the exact same way.
Which is a great
The challenges that we often encounter in the management of people that are on insulin is that of user fees. Insulin patients often come every month to the health facility to access their treatment, whereas other people living with other chronic conditions like HIV come once in a period of 3 months. So for insulin patients, it means that they have to pay user fees 3 times over that same period.
We are very privileged in the fact that no matter where you're from, no matter the age you've been diagnosed, you have access to insulin through our healthcare system, which is a great gift for us all. We do have mostly access to human insulin, especially if you are diagnosed in an adult hospital. But the biggest issue for me is that we actually do not provide efficient education regarding diabetes management and insulin use when people are diagnosed and throughout their lives with diabetes.
Plus panyaya yemasyringe acho ari kunetsa zvekuti ndinodzokorodza syringe 1 ndinoidzokorodza ndaidzokorodza futi kusvika yakurwadza kuzvibaya ndo pandinozoichinja asi kana pasitorina imwe syringe ndinotoramba ndichitomanikidza iyo syringe yacho.
The first thing that I want to ask for my country is for type 1 diabetes to reach a primary level of attention on a national scale. So people living in provinces don't have to waste their own resources and income to come all the way to Lima to obtain the insulin that they need.
Saka taikumbira kuti dai hurumende yedu ikatibatsira nekutitsvagira mushonga weinsulini wekuzvibaira netsono dzacho deswa pasipatara zviri padhuze nepatinenge kungava zvimakliniki zviya zvidoko hazvo asi mushonga weusvike nokuti tinenge tisina mari yekuzokwira.
What I would suggest to the government is to put insulins in the health insurance plans or coverages so that we can be able to afford the insulins by paying a little amount of money.
The two actions that I believe our government should take to address these challenges. First, logistics necessary to distribute any kind of insulin. And second, that the government knows about the reality. Every year a friend dies with diabetic complications, not only because the lack of education, but also they cannot access to the insulin so easily.
We advocate to have funding to meet the needs, especially with the current socio-economic situation in our country.
أما إذا بدنا نحكي عن مرضى السكري اللي هن النوع الثاني أو الغير معتمد على الأنسولين كليا، يعني هن نقصد فيه المرضى اللي بياخذوا أدوية فموية بالإضافة للأنسولين، أو في البعض الجزء منهم اللي بيكون في عندهم مضاعفات، بعض المضاعفات المعينة اللي بيضطروا بس يستعملوا الأنسولين. وهون نحن طبعا بنأكد إنه يكون هذا الشيء بغض النظر عن الجنسية وعن جنسه وعن نوعه لهذا الكائن من كان، لأنه هذا الشيء راح يأثر بهذا المجتمع مكان ما هو موجود.
In my opinion, I would suggest that the availability and affordability of insulin should be addressed both nationally and internationally in order to make sure that all the people in need of insulin should be able to access it. Thank you.